Hi, my name is Dr. Lori Cayley. I'm a functional medicine practitioner and I help women who have thyroid conditions to reverse their thyroid conditions naturally so that they can experience optimal health and get their lives back. I was speaking with a woman yesterday who was telling me about her symptoms and what she has been going through as far as her health goes. And she was confused as to whether her thyroid or her adrenal glands were really what was the problem and what she should address. And I thought that would be a good topic to talk about in this video. The adrenal gland, your adrenal glands are small glands that sit on top of your kidneys, and they release over 100 different hormones, and cortisol is one of them. So most of us have heard about cortisol, and cortisol plays an important relationship or has an important function with the thyroid gland that I'm going to talk about in a minute. But if you have symptoms of adrenal problems and thyroid problems, they can overlap, so it can be confusing. So if you're experiencing fatigue or weight gain, have a lot of stress in your life, it can point back to both the adrenal glands and the thyroid. So some of the symptoms of adrenal issues are headaches, lowered immunity, inability to handle stress, having high levels of fatigue every day, having asthma or allergies, dizziness, gaining weight in the mid-body area, experiencing dizziness and headaches and insomnia. Now, let's talk about the role that cortisol plays with our thyroid. Cortisol is really important in converting T4 hormone to T3 hormone. And we need T4 to be converted to T3 because T3 is what gives us energy, it controls our metabolism, it helps our hair to grow, and it goes into every cell in our body. So we need T3. We need T4 to be converted to T3. And cortisol actually plays a role in T4 being converted to T3, and that happens outside of the thyroid gland. So we have to make sure that if we're trying to reverse our thyroid condition, that we do look at our adrenal glands as well. And when I'm working with clients, the way that I approach it is in looking at comprehensive blood work, I also make sure to get a full thyroid panel. So that consists of looking at or testing total T4, free T4, total T3, free T3, reverse T3, and the thyroid antibodies, so that I know exactly what's going on with the thyroid and the thyroid hormones, and knowing if the individual has Hashimoto's by the antibodies being elevated. And I also commonly recommend an adrenal stress index test, and that is a saliva test. So we're testing 4 samples throughout the day of cortisol. And cortisol should be highest in the morning. It helps us to wake up. It gives us that get up and go feeling in the morning. And then cortisol should taper off throughout the day, being low at the very end of the day to allow us to get to sleep. And if there are issues, of course, with cortisol, as I said, it's important to address that to make sure that the thyroid hormones or T4 is being converted to T3 the way that it should. If you would like some more ideas and tips and secrets about how to reverse your thyroid condition, I have a free training. It's called Healthy Thyroid for Life. 5 secrets that women are using to reverse hypothyroidism and Hashimoto's naturally. And I am going to put the link to that free training in the description of this video. Thank you so much for watching.